Hi, my name's Denise, and I live in San Antonio, and I am retired. When I first started noticing the back pain, it just kept getting worse, and I wasn't able to do the baking that I'd like to do. Traveling was really difficult for me, especially getting through the airports from point A to point B, and it just wasn't enjoyable for me to go because I knew I was going to be in pain the whole time I was away. The pain really did affect my marriage and our social life. It was hard for me to walk any distance without using a cane, or I would get tired quicker, and it just wasn't enjoyable anymore. I contacted my primary care doctor, and she sent me to see a neurosurgeon. My surgeon and I had discussed all the issues that I was having, and we decided to start with the lumbar fusion to see if that would take care of, most of the issues. So I had 2-level fusion in May of 2019 and did great with it, but still had some nagging pain. And the surgeons, said that we needed to maybe look into the SI joints, and so he ordered a CT of the SI joints. When I came back to review those, he said that I definitely needed to see Dr. Zavala to have it evaluated.
My name is Gerardo Zavala. I'm a neurosurgeon here in San Antonio, Texas. I'm the president of Neurosurgery and Spine Consultants, and we are here to talk about an often overlooked source of back pain. The SI joint is a complicated structure that actually gives you stability to the spine, the hips, and legs, typically to rule out other possibilities of pain. Patients should undergo a series of clinical questions of where this pain is, where does it go to, where does it start, and then during a physical exam, really kind of pointing to something called Fortin's point, where pressure on that specific area causes pain in the SI joint. And then pretty much the gold standard is if you get improvement after an injection, that's almost pathognomonic for an SI joint problem that is present in the patient. And it's extremely important to emphasize to the patient that it's going to be a short duration of improvement. Treatment options for SI joint can be a variety of different ones, to include SI joint injections, physical therapy, massage, chiropractic manipulation. When those more conservative manners haven't worked, then I think patients should consider this surgical intervention. The SI joint procedure itself is a small incision that's placed on the affected side, and intraoperatively we're able to place triangular devices that help fix the sacrum to the pelvis. Typically it takes about an hour at maximum. Patients do extremely well postoperatively. Some muscular tenderness around the site of incision is to be expected, but it's very temporary, and patients can be up to normal activities within about 10 days to 14 days. iFuse is I think a tried and proven product that has had a lot of literature behind it.
I had my first SI fusion on the right side in August of 2020. The first 2 days, there was some pain, but it was manageable with some pain meds. I went to see Dr. Zavala for my 1-month post-op, and we decided that it was time to schedule the left side fusion, which we did in October of 2020. About 6 weeks after my second fusion, I had contacted Dr. Zavala and asked if I could start doing some exercises and stuff, and he said yes. So I hired a personal trainer, and we started just with small weights and mobility exercises. It's now been 9 months, and I am boxing, weightlifting, planks. I now ride a bike 2 or 3 times a week with my friends, and we walk the other days of the week. It's been great to be able to actually be a part of the circle of my friends again. I don't feel left out. iFuse gave my life back to me.
If you have any of the symptoms that we described today, back pain localized to the side around the hip, or hip pain, leg symptoms, or a nagging back hip pain that hasn't been well diagnosed, remember, this is underdiagnosed and can be missed. And so come see me. I'd be happy to help. We will be here open and available for you.